Hi everyone, Dr. Gupta here. Welcome back to my channel. I'm a facial plastic surgeon and a board-certified head and neck surgeon. Today, I'd like to talk to you about the complications associated with fillers. So fillers are medical procedures, and we really have to treat them as such. There can be some real side effects if we don't do that, and I'd like to talk about some of those today. So fortunately, the most common complications from fillers are relatively mild and include what we call injection site related reactions. These include things such as bruising, swelling, pain, and discomfort. Now, if you go to the right injector, they'll make sure to minimize your pain and discomfort, and this really has to be tailored to the individual patient and their tolerance to different things. But what I like to tell my patients is yes, it will be a little bit uncomfortable, but we will do everything in our power to make sure that it's as pleasant an experience as it can be. And the results will be totally worth it. So bruising is something that I like to discuss with my patients because this can happen with even the best injectors. If someone tells you that they've never bruised a patient after fillers, well, they're lying to you, and you should maybe not trust them as much, or they just haven't done enough treatments to have this side effect. The main thing about bruising is that if you have an event coming up in 2 to 3 days, most of the time you're going to be just fine. But there is always a small chance that you might have a bruise at the event. So that's something to really think about. And the blood supply tends to come in the dermis, which is the deeper layer of the skin, and the subcutaneous tissue, which is just below that. Well, this is exactly where a lot of times we're injecting filler. We do a lot of things to prevent bruising, such as use a cannula in certain cases and have you hold off on certain medications, such as Advil and other blood thinners, which your injector should talk to you about because this is something that needs to be done even before you have the injection and usually continued afterwards for a small period of time. Bruising can also be a concern, especially around the eyes, because this area has a lot of blood vessels and the skin is very thin. And so this is always something that we have to be aware of when treating in this area. The second complication of fillers I'd like to talk about is nodules. So nodules can happen immediately after the filler is injected or may happen a few days later when the swelling has come down. So what a nodule is it's a lump of filler. What I recommend to my patients is 3 to 4 days after you've had the treatment, look at the area. Do you see any lumps? Do you notice any nodules? Well, if that's the case, then let your injector know for sure. But often these areas can be massaged away within about the first 10 days. Now, if you feel a lump or a nodule, but can't really see it, then I generally recommend that you leave it alone because massaging that area can actually move the filler away to an area where you might not necessarily want it, or can kind of speed up that process by which the filler dissolves, so you might not get as long out of it as you would have otherwise. The third complication of fillers I'd like to talk about is granulomas. So granulomas are reactions to the product that don't happen right away, but generally occur weeks to months after the product has been injected. What you'll notice is you'll notice some swelling in the area. If a granuloma does develop, there are various ways to treat it. But it's important to note that this is a later complication associated with fillers and doesn't happen right away. So another later complication we see with fillers is something called a delayed hypersensitivity reaction that leads to redness in the area where the filler was injected. This is also a delayed complication similar to granulomas we just talked about and tends to occur weeks to months after you've had the filler injection. This is thought to be due to something called biofilms, and so we treat this a little bit differently than we treat granulomas, even though they're both late or delayed complications associated with fillers. Now, the last group of complications I'd like to talk about associated with fillers are the most severe. These are the vascular complications, and vascular means related to a blood vessel. What can happen occasionally is that filler can compress a blood vessel, or it can accidentally penetrate a blood vessel and move through that blood vessel to an area where it's not supposed to be. In most cases, this is a temporary situation, and your injector has to be able to recognize it right away so that the appropriate treatment can be taken. There's a small number of patients who have been reported to have loss of skin and tissue, as well as in rare cases blindness as a vascular complication of fillers. So this can be really, really severe. The most important way to prevent this is a solid knowledge of the anatomy, and I can't stress this enough. Your injector needs to know where they're injecting and what structures are in that area. As a facial plastic surgeon, my whole training has been focused on anatomy of the head and neck. And I really suggest you go to someone who's very, very well versed in this area. One area that's of special concern is liquid rhinoplasty, or fillers to the nose. This is the area that has been associated with the highest rate of blindness from filler injections. And specifically, if you're interested in this, you should really go to someone with a lot of experience in this area. So today we talked about some of the complications associated with fillers, including injection site reactions, specifically pain, swelling, discomfort, and bruising. We talked about nodules, which typically happen either at the time of injection or shortly after, within a few days. We talked about granulomas and delayed hypersensitivity, which are usually more delayed responses to filler and can actually happen weeks to months after a treatment. And then we talked about the vascular complications, which can be really devastating if not recognized early and treated adequately. Your injector really needs to do a good job in understanding the anatomy of your face and knowing where to inject, how to inject, and know when something goes wrong. And I can't stress that enough. Well, I hope you guys enjoyed my video talking about the complications of fillers. If you're interested in this topic or other topics in facial plastic surgery, make sure to like, comment, and subscribe. And I'll see you in the next one.